What happens when a doctor who has worked in long-term care, acute care, and academic medicine looks at the system and decide that there has to be a better way? Today's guest didn't wait for an answer. She built one. This is Hidden Shift. Welcome, Katarina.
Hi, Christine. Thank you so much for having me.
Of course. Tell us who you are in your own words.
So, I'm a family doctor by training, and I would overall say I'm a care of the elderly physician. So, I have additional training after family medicine in the care of older adults. And I've had a number of different roles through my career and currently have kind of a varied practice. But ultimately, my passion and my interest in is the care of older adults, both caring for them directly myself, but also improving the system in a way that provides better care for older individuals.
Wow, that's so inspiring, and it's an amazing mission of life that you have for us today. So let's look a little bit more about your life inside the system and your lived experience as a physician. The first question I have for you is, as you mentioned, you've worn many hats: hospital, medical, director, academic. What did this journey teach you about Canadian healthcare?
So I'll just tell you a little bit more about the roles that I've had over the past few years. So currently I work as a hospitalist. I do acute care medicine. I also work as an attending physician in long-term care. I've also previously held a role as a medical director in long-term care, so I understand that system from an administrative and a policy perspective as well. Long-term care in specifically has been a bit of a passion for me, and I'm also the vice president of Ontario Long-Term Care Clinicians, which is a non-for-profit organization focused on education and advocacy in long-term care. The other role that I currently have is at TMU. At the new School of Medicine as a program director for the Care of the Elderly program. So I've taken kind of an additional focus on education. So I've been in the system through different roles and seen the level of complexity that goes on. It I just forget the question now that I
Yeah,
wanted
no,
to.
I wanted to ask you, like, what can you tell us about, like, how the system does it actually work? That was like another question, how it works, the inside. But I think you actually answer, like, we're giving as you provide us with a little bit of like, introspection on what you're doing and all your different role. We had the chance to learn a little bit more about how you use your everyday role to make the system work, which lead me to the second question. Where did you feel most frustrated as a clinician inside traditional medicine?
Yeah, so the people that I usually look after are often quite elderly and quite frail. Sometimes they're a little bit younger, actually, but that have significant multimorbidity. They have really advanced, complex disease, and often many of them. And I, time and time again, really was in a place where I felt that I wish that I saw that patient years prior and had been able to actually advise them on how to delay progression
Yes.
or sometimes even prevent many diseases. That's kind of one aspect of care that became frustrating. And the other was actually working with elderly individuals. I often speak with their family members, often their adult children, and when they're going through, watching their parent deteriorate, decline, particularly when it comes to neurocognitive disorders. Not only are they having that distress about what's happening to their loved one, but they also worry about what's going to happen to them as they age.
Age.
They would ask me questions around kind of what they can do or where they can go to really take a preventative approach and address their own risk factors, and I often felt really ill-equipped to provide that kind of advice and that kind of care. And that's those were the kind of biggest challenges that I saw that left me feeling like I need to do something differently.
And then would you say that that's where a patient falls through the cracks when you look at from a doctor perspective?
So I think that's an interesting question. I think traditionally, when we think about a patient falling through the cracks, is having, and I can think of examples off the top of my head, seeing someone in the hospital, at the age of 52 with advanced ovarian metastatic cancer, who unfortunately had sought primary care help. They saw their family doctor. Their symptoms were initially minimized and not taken seriously. They failed to kind of investigate, and then eventually in the investigations that were initiated took too long, and there was this prolonged period of time before the patient actually deteriorated and ended up in hospital with us. And I think that's what we usually think about when we think about someone falling through the cracks of traditional medicine. But I think taking a different perspective is that anytime that I see individuals, particularly younger ones, with this level of severe morbidity and functional impairment, in a way that's kind of them falling through the cracks, because we know that we could have done so much more to actually prevent and alter the course of their health.
And was there a specific moment where you thought that, this isn't working and I need to do something different?
I wouldn't say that there was a specific moment. I think it's really a culmination of these moments that happened more and more frequently as I started to think about this in this
Yes.
way. Kind of seeing these types of patients where I felt like I could be helping them if only I could see them earlier on. I think in combination with kind of my own health journey and recognizing the limitations of traditional allopathic medicine in addressing many issues that people have when it comes to chronic illness.
Oh, thank you so much for sharing. And what you're doing is admirable and it's so inspiring. And I think many Canadians need to learn about your practice. And we just spoke about the life inside the system. And now I want us to dig a little bit more into the current landscape. And I want your honest take on innovation in Canadian healthcare. So my first question will be, where do you see Canadian healthcare getting it right when it comes to innovation? And where do we have persistent barriers and challenges?
That's really a great question. I think there's so much that we're doing that's really amazing in the healthcare system. I mean, first of all, having a publicly funded healthcare system is so important in terms of actually allowing for equity and access to everyone in our communities. I think we're doing a really good job incorporating technology and AI and virtual platforms to provide better, quicker, easier access to care, not just kind of in kind of routine practice, but also reaching kind of remote and rural communities where it's traditionally sometimes difficult to get specialists out, for example. And so it's been really great to see government funding and support being put into kind of systems like this. But I do, think that with having a publicly funded healthcare system, that creates a bit of a bottleneck, so to speak, a bit of a barrier for new technologies, new advancements to really make their way into kind of everyday practice, because we're regulated by policies around health and what we can do, what we can't, and I think there's benefits to that, but at the same time there can be challenges with really bringing cutting edge aspects of care to
The red
frontline.
tapes. Thank you so much for sharing. And as a lot of Canadian, I've never heard the word of functional medicine. I know I've had, but they just know that they've been to to their doctor, gotten a prescription, and still don't feel better. Is that the gap SageMD is trying to fill, and why is it taking so long for this approach to be taken seriously in Canada?
So I'll start off by kind of explaining a little bit about what functional medicine is, because you're right. I think many people don't actually know what that term even means. Kind of in summary, it's really looking at root cause of disease. It's trying to optimize function of the systems within the body, which will ultimately improve function of us as a human
As a human
being,
being.
and also taking really a more proactive, preventative approach to care and trying to address abnormalities or perturbances in the system before they actually lead to severe disease and irreversible
Yes.
damage.
Wow. So functional medicine is still seen as an alternative by some. Why do you think that perception exists in Canada?
So it's I think most people really don't know what it is, and so when they hear terms that they're not familiar with, they assume that it is alternative. But I think from a patient perspective, you know, when I have conversations with individuals, whether it's friends, family, people that I meet at gatherings or events, and explain to them what functional medicine is, they say to me, "Well, isn't that what medicine should actually be?" And so they see that as really not an alternative way to do things, but an optimal way, a way we should be doing it. From a physician perspective, though, there are some nuanced differences, and I think that really comes to our approach to testing and investigating for abnormalities in terms of when we're testing, what we're testing, how frequently we're testing, and the target intervals or reference ranges are a bit different because we're actually trying to optimize function rather than actually just meet kind of a bare minimum of a level or reach a level where we either have or don't have the disease. And so I think, you know, you had asked me earlier kind of why has this taken so long to kind of come to Canada. I think there's aspects of this kind of care that many people do practice, but again, we're limited by policies and regulations of what family doctors can do, what they have time to do, and what the government actually funds in terms of testing. And so I think there's although, you know, kind of on the surface, it seems like a very novel and unique or different way of doing things. It's actually, I think most people would agree, a way that most people would want to be cared for.
And is this practice recognized in the USA?
It is, yes. Yeah, absolutely. So one of the main organizations that kind of provides teaching and certification is the Institute of Functional Medicine, which is based out of the US.
Okay, well, thank you. And what are patients asking what are patients asking for that for the traditional system simply isn't delivering? What are they asking that it's not delivering?
I think they want preventative care, they want holistic care, they want personalized care, and they want that to be done in a way where their physician actually has time to hear their perspectives, to hear what's important to them, and actually help them achieve health. And achieve a state of wellness rather than what I would consider, a sick care system that we are practicing in, where we do a really good job at looking after individuals once they've already unfortunately gotten a disease or an illness. But patients don't want to wait until they're sick. They want to work with their care providers to actually feel better and to prevent disease and optimize their well-being.
Wow, thank you so much for all this information. I'm so happy that we have you here today. Many of the stories we share on Hidden Shift have something in common. Doctors looking for more flexibility, more control, and better ways to practice. That's exactly why Locum exists, connecting physicians with flexible work opportunities while helping clinics and hospitals fill real gaps in care. Locum, rethinking how doctors work. Talk about how did you build SageMD? So tell us more about your new startup.
Yeah, thank you. So recognizing these limitations in the system and kind of being the frustrations that I had with my own clinical practice, I wanted to do things differently. I've kind of found what I was looking looking for through this functional medicine perspective. But I recognize that unfortunately I would not be able to do that in a traditional family medicine practice, the way that we are able to do that in Ontario, or in Canada for that matter. So I decided that I will kind of step out of the box a little bit, and find a way to provide the kind of care that I think people want and people deserve, in a little bit of a different platform, that kind of sits outside, and I would say parallel to traditional medicine that we
because you're still practicing traditional medicine. You're just adding the functional medicine on top of it, right?
That's right. And in my clinical practice and long-term care and the hospital work, I still apply some aspects of kind of the functional medicine approach. I still try to look at root cause of disease. It's just that there's limitations with what we can do in those care settings and in a publicly funded system.
So, and how does what those care actually look like at SageMD versus a traditional practice?
So there's a lot more time spent with me as the physician. So
Yes.
it's a very, very comprehensive intake process, where we learn all about your history from really the time of your conception to through your childhood and through all of the various stages of your life, and illnesses that have occurred, and taking that into context of what's happening currently, what's happened in the past.
So you can see the future.
Exactly, while also looking at very unique aspects of the individual, including their genetic risk factors, including their kind of propensity for disease, and looking at their current symptom burden, and what is important to them. What are their goals? What are they hoping to achieve with seeing a functional medicine practitioner? What do they want to be focusing on? That's kind of where we start, and really it's a process that does take time, because it's not a band-aid solution. It's really trying to tease out what is the root of someone's symptoms, or what are abnormalities that we can kind of optimize, and that can't happen with just a quick prescription that you hand over to somebody.
Exactly. And what did you have to unlearn from traditional medicine to build this?
I think it's really that reflex to immediately diagnose a symptom and provide a treatment. We're really trained to do that as physicians. We're problem solvers, and our current medical system teaches us to make an ICD diagnosis, and then you have an algorithm of what medications you prescribe based on that diagnosis. And that's in a way sometimes what patients expect, and we feel as practitioners, because we want to help, it becomes a reflex of this is how I help you. But attempting to do that so quickly without actually taking the time to look at all the factors that are contributing is ultimately doing a disservice to the patient.
Yeah, and talking about the client expectation, what has surprised you most about patient when you give them a different kind of care?
It's interesting. I find I started to become surprised by how relieved people feel, just even after that initial consultation, because they feel like they're finally being heard. Like someone's finally actually taking them seriously. They're not dismissing their symptoms, and they are willing to work with them to find a better way forward. And so initially when I started doing this, it was, before we actually do any interventions, just how much better someone feels by being in that setting, and being in a place where they feel that they can actually get the help that they are looking for.
Exactly, to live a longer life.
Yeah, and if I can add on to that, I think what patients seem to be surprised by, and I kind of notice that time and time again, is that when we they have a goal in mind, and we focus on addressing the root causes of that, but because we're taking a holistic approach, and many of the aspects of care are not actually that targeted, the person actually starts to feel better in so many ways other than what they were actually just hoping to
Yeah.
address. And they often people will normalize a lot of their chronic, mild, vague symptoms, and they'll say to me like, "Wow, I didn't know it wasn't normal to feel this way
This
or to
way.
feel that way." And so,
Because they have normalized that for a long
exactly,
time.
exactly, yeah.
Wow. I mean, it's so important to feel seen and heard, especially by your physician. And I think what you're doing is just amazing. And what do you want Canadian patients to know that they probably don't?
I think most people don't recognize how much power they have over their own health. I want people to really appreciate that they have so much control and autonomy over their wellness. And I want them to feel empowered that they can take action to improve their health, that they can take action to advocate for themselves and look for the kind of help that they feel that they need.
Wow. And what does the future of family and elder care look like if we get it right?
I think that it would mean functional medicine not being seen as this weird alternative
Yes.
thing that some people do, but this actually becomes the standard care that we can provide to people. That we have a robust primary care system that looks after people of all ages and into their older years, where their family doctors, and not just that they have a family doctor, but a family doctor who's resourced in a way that they can actually provide them the time, the knowledge to provide really personalized and preventative care throughout the lifespan.
Wow. And how do we sign up to become one of your patients? When can we do that?
So for those looking for functional medicine practitioners, they can be found on the IFM website, specifically for my practice. SageMD.ca is where they can find me. But depending on where people are who are listening to this podcast, I would encourage them to look for local providers, because it's not just me who's doing this, and I would like anyone to be able to access this kind of care.
Beyond the hospital walls, beyond the traditional model, Dr. Katarina Lakovic is quietly building something different. This was Christine Dikonguè for Hidden Shift.